Oh, did it really?
Oh, yeah, that's
Woohoo!
like 6 times more powerful than prednisone.
Ooh,
Yeah,
that steroid that,
yeah.
Wow. So you good to go, huh?
Oh, man, I'll tell you what, too.
That Superman story I told, you know, there are some people that have been turned into Superman.
11 o'clock.
Thank you.
Hey, good morning, Decatur. Hope everyone had a great weekend. Not only was it, yesterday was Martin Luther King Day, but it was also the beginning of the distribution of the COVID-19 vaccine to the eligible members of our community. We're thankful for that. Had a chance to go by the health department and saw all the public safety support there and how things were set up, and it was good to see and know that
You're
that's
doing
taking
great.
place. Yeah, so thankful for that. So I'd like to commend y'all for the work that you're doing, Decatur Morgan Hospital, everything that y'all are doing, all of our local pharmacies and distributing the vaccine. And this is certainly a teamwork, and each and every one of you play such a vital role. So Kelly Powers, President of Decatur Morgan Hospital, thank you for joining us again today.
thank you.
And then Judy, the Department of Public Health, thank you for being with us.
Glad
It's
to be
good to have you. You know, we have a lot of numbers, and I think y'all have a lot of numbers. Why don't we just start with, Kelly, why don't you give us an update from the hospital, if you don't mind?
Well, I'm happy to report that our numbers are down a little. We're at 73 positives, 7 PUIs or presumptive people, 11 total in ICU that are positive, and 10 of those on the vent. So we have had some more deaths since last week, which I'm not happy about at all. Our ICU still remains full between the COVID and the non-COVID patients. And the hospital still, you know, seems full. We're still about 160-something patients today, inpatients. Our employee numbers are coming down, so that's another good sign. So I hope that we just continue on, you know, wearing our masks, social distancing until we can get all the people vaccinated. We do need nurses. You know, I'm going to mention that again today. Lab techs, patient techs, respiratory therapy. We are down and really need to get some more nurses in to help us get through the next few months with that. But other than that, we're hanging in there.
Good. Thank you, Kelly. Thank you. Judy?
What do I say, Mayor? What do I say?
I'm eager to hear.
Well, as everybody knows, we kicked off the vaccination program yesterday, particularly for those that are 75 and older, still doing frontline healthcare workers and first responders. I will tell you that we had 300 doses of vaccine, and we turned a few people away. Late yesterday afternoon, we gave all 300 doses. The good news is we were all able to run down the FedEx man this morning, and so we have some more doses, and the clinic is going rapidly as I speak. It's and I know that people don't, you know, it's a tough time, and I know that people are having a challenge with this, but I commit to you again that if you want a vaccine, you're going to get a vaccine. It may not be today. You do not have to run me down or the police force that are in front of the health department. We will get you a vaccine. And I want to talk a little bit about the appointment system in a minute, but I also want to say that the thing that has come the most out of all this is the hope you see on people's faces. You know, there's just been something magic about getting that first dose or knowing that you're going to get that first dose that just says, you know, we're going to get through this. We're going to get to the other side, and we're going to get through this. I will also tell you the other kind of heartbreaking part of this has been we've also identified the level of desperation and fear that there is in people. And it's kind of like when you're out in you know, you're out in the middle of the water, out in the middle of the ocean, and there's the life preserver is just out of reach. And so people are reaching for it, and we're doing everything we can to move on so that we can get to everybody who not only wants but also needs to get this vaccine. So having said that, let me back up and say that in the 300 doses, it is our intent, now that we've run down the FedEx man and gave him a cup of coffee, it is our intent to do 300, a minimum of 300 more today. And as long as we have vaccine, we're going to do 300 every day. Now, it's been a while since I went to school, but I think the last time I counted, that's about 1,500 doses that we hope to accomplish this week, that folks that will kick off. Our wonderful partners at the hospital are doing something very similar. They're building up to that same level of, and you know, if Kelly and her team and the health department and their team can each end up doing 1,500 a week, in 2 weeks, we could have the majority of our senior folks taken care of, and we can move on to other groups. And I will tell you that's our huge commitment. Now, the biggest stumbling block has been vaccine, the availability of vaccine. And some of you may have to give me a job in the future because the state people are about ready to kill me for beating the drum on getting vaccine for up here, but we don't care, do we? You'll give me a job, won't you, Mayor? I sweep very well, but anyway. But we're gonna keep doing that so that the individuals in North Alabama can get the vaccine. I will also tell you that in my 12-county area, and that's what I covered, we gave over 3,000 doses of vaccine yesterday.
Wow.
I also want, there has been, you know, the right way to do this. You learn as you go. Nobody's ever done this before, but you know, some of the outcries that we have kind of gotten at the department has been, why don't we have the mega clinics? Why don't we have these big, huge clinics? And you know, that may be something that we end up having to consider down the road, but if you're having a clinic in two sides of the district, you know, and each one of them does 1,000 people apiece, that's 2,000 in a day. And what we did is we did 3,000 in a day, and everybody in every county had an opportunity to get that, and we're gonna repeat it again today. So, you know, right now, we feel like in order to make the vaccine accessible to everybody across North Alabama, that we're doing what we need to do. I will mention, even though it's not this county, that Madison County also ran out of vaccine yesterday, and they did 581 individuals. They also chased down the other FedEx man, and they're back in business again today. Poor FedEx man, y'all be nice to him when he comes back, because obviously. So, but again, the biggest issue has been the availability of vaccine. And I commit to you again, and Kelly commits to you again, as that vaccine comes in, and there is a promise that it will continue to come in, maybe not in a flood, maybe more of a trickle, we will make that vaccine available. The second thing that kind of has been a little bit of a challenge for us has been the slowness of doing the paperwork. Now, it's not big paperwork, but you still have to fill it out. And so people who do not have it ahead of time, it's taken some time to get that done. And you know, those of us who are a little older, and I include myself in that group, you know, we don't write as fast or quite as well as we used to, because we just don't do checks anymore. Anyway. But you know, that's been a bit of a challenge. If you can get the consent form either by coming by the office or at the City Hall or at wherever, and lots of people, please try to do that and have it filled out ahead of time. Now, I'm not telling you we're not going to see you if you do it, because we are. But you know, it's helpful to you, and it's also helpful to us. The other thing that I am going to say that we probably are going to do after, we're going to fulfill the appointment schedule that we've had this week. And but I think most of you know the state appointment system was somewhat of, for lack of a better word, a disaster. A lot of people couldn't get in. A lot of people called over and over again, and it was just very emotionally traumatic, and you know, a lot of despair that went with it. So we're going to honor the appointments that have been made this week, but what I think we're going to probably do beginning next week, and we're still thinking about this, is we're probably just going to give out a number of numbers based on the amount of vaccine that we have available. Because we don't want people to wait in line for 3 hours or to wait all day and to sit up there only to find out that there are no more doses left. So we probably are going to convert to a walk-in, to a walk-up, you know, by number system, so that people will know how many numbers we have every day. Again, contingent on the amount of vaccine that we have. You know, then we keep going. I promise you. Going as long as we're right going. I do mention that at least at our health department, at any of the health departments in North Alabama, you do not have to call to make your second dose. You do not have to call to get your second vaccine. When you're up there, you're given a card that says when you got your vaccine. We're also giving you a little calendar that says when your second dose is due for you to put up. And we're doing it this month, since it's Heart Month, we're gonna do it in pink. Next month, I don't know, maybe green, maybe who knows. But at any rate, but it has your date on there. If you got a vaccine today, you're due back February the 16th, we already have you a slot. You do not have to make a slot. So that hopefully will cut down on some of the concern that folks have had. Please get that second dose. And, you know, it's really important, and we do encourage you to do that. And I just want to say that, you know, when they did the trials on the vaccine, it was with 2 doses. And what happens is when you get that first dose, it hunts those receptors in your body that's going to be most attentive to if it's exposed to the COVID virus. And it grabs them like it's grabbing you by the collar. And then when you get that second dose, it's holding those receptors and it gives it a knockout punch. So you need not only the grab of those receptors, you need the knockout of that COVID vaccine when it comes in there. So it's extremely important that you do get that second dose, and we're gonna have it waiting on you. You don't have to make an appointment. We're gonna be ready for you. The schedule is already there. I think that one of the things we were gonna try to do today was do some questions and answers maybe, and so anyway, I guess unless you all have questions, I guess that's where we are.
I want to commend you on your leadership. You've shown this year been able to a new way of doing it that will be more efficient, bring less stress to our that
Community,
75-year-old
absolutely.
community.
Well, to all of our community,
Sure.
yeah.
But thank you.
You're very welcome. You know, and I would just have to say, I thank you very much for your comments, but I will also have to say there is a biblical verse. Perhaps I was created for a time such as this. Just call me Esther and we'll go on, okay?
Very good. All right, so we do have a few questions from the public. And the first is, my wife received the Moderna vaccine on January the 2nd at the health department through the drive-thru in Fayetteville, Tennessee. They gave her a card showing she is to get her follow-up injection on January the 30th, but will not give her an appointment time. Can she schedule her follow-up injection here in Decatur where she lives, or where we live? Who do we call? And that's from Floyd B. via Facebook.
Well, on behalf of the health department, I will tell you up front that if you got Moderna at one place, as long as you stick with Moderna, you at the right time, you can get it at somewhere else. And if you have a card that tells us that you got your Moderna on January the 2nd and you need it on January the 30th, I will tell you that the health department will give you that vaccine in any county. And we have people, you know, people have been extremely desperate in all this, and I'll, if I can get through it, I'll tell you a story in a minute. But, you know, if people have driven from Birmingham to try to get a vaccine in Coleman County, people have driven from other counties. You know, we have folks in this county and in the state that go to Vanderbilt for medical care. So, you know, and if they give vaccine to some of our folks, why wouldn't we give vaccine to the folks that need it here? And if somebody went to Chattanooga or wherever they went to get that, Fayetteville, Tennessee, and they live in this county, will we make every effort to see that they get that second dose? Yes, we will. So it will be done.
Okay, thank you, Judy. Kelly, you have anything to add to that?
No, I think Judy and I differed a little on that because the allocation of our doses come out. When we get the first dose, then Moderna goes ahead and gives us the second dose when available to hold back for that patient. So my only concern is worrying about running out of doses. And so when they got their first dose in Tennessee, Tennessee's going to get their second dose. But if we have enough, you know, that's my only concern is I don't want to run out. And I want to make sure everybody gets that second dose and as many first doses as we can give.
So we can do the knockout that Judy mentioned.
Yeah. Knock it out over at the health department, but no, I'm kidding. I don't think we'll turn you away.
I appreciate
you know,
that, Kelly. I absolutely understand, and I think we all have that concern to some level. I'll just tell you that my experience working with public health all this time is there are folks that are not going to come back for their second dose.
I know.
And so, you know what, Miss Fayetteville, Tennessee, that second dose is sitting there waiting on you.
Good.
All right, so our next question, what can be done about non-mask wearers? And this is submitted from Kathy W. on Nextdoor. I'll give you my thoughts on that. First, stay clear of them. Just walk away from them. Be nice. And then you would want to get with the management of the particular location of wherever you are. If you're here at City Hall, get with just go to police and get with them, and they'll take care of that. But get with the leadership of wherever you are. All right. So the next question is, where will vaccine be offered in Decatur? When will 65 and under medically at that risk group be offered the vaccine? And that's from Deborah W. At Next Door.
Anytime now, and as I told you earlier, between Kelly and I, we're trying to get as much done in the next 2 weeks as we possibly can, so we'll be prepared to move on there. I think we probably both have already stretched the Band-Aid a little bit, and I'll try to tell my story. It's a little bit. We actually had a 77-year-old who came to get a vaccine, and he had his 74-year-old wife with him. And he wanted to register, but because she had cancer, he wanted her to have his dose.
Wow.
And we won't just tell the rest of that story. You all figure it out on your own. But we aim to take care of the folks in this county. Both Kelly Powers and the health department, Judy Smith and the health department do.
Yes.
And so sometimes you just have to stretch the Band-Aid. And we are, or the rubber band, I guess was a better choice. We are going to move as fast as we can to open up the door to that, because we do agree that those folks do need to be vaccinated. And I will just tell you up front, don't call me. I'm the biggest wuss in the whole business. And, you can get to me with a sad story in a heartbeat. But at any rate, I need to take my number off the call list now, don't I, since I made that comment. But at any rate, we're going to do whatever we can to get you a vaccine, and we're going to move as fast as we can. We are having clinics 5 days a week this week. We plan to have clinics 5 days a week next week, and we plan to continue those clinics as much as we can going forward. The other thing I do want you to know is right now the state health department is working with multiple pharmacies, urgent cares, other medical facilities to see how many they can get on board. And that is a blessing for both for the public as well as for Kelly and I,
Right.
in terms of the fact we want people to be able to go to various places and get that. Again, the biggest issue right now is the availability of vaccine. And it seems to be a finite amount of vaccine. And if you split it 10 ways instead of splitting it 2 ways, it's still that same allotment of vaccine. But I will tell you that there is a lot of pressure to the federal government and to the companies to go ahead and get that vaccine. There's also a couple of other vaccines very soon on the horizon. And as we do that, we will have more providers, we will have more vaccine, and Kelly and I are going on vacation and not together because we don't want to talk about vaccine.
Or anything COVID.
That's right. We're not taking the mayor either.
I did want to give you an update, Mayor, on what we are doing. We opened the clinic yesterday on the Parkway campus. You can go online at our website, DecaturMorganHospital.net, and there is a link for you to fill out the information to sign up. We also have a phone number you can call, which is 256-973-2185. That's 256-973-2185. Leave your name and number on the voicemail, and someone will call you back. Don't do both. So if you go online and fill out the form, you'll get in line to get a call or call the number. Either one will work. And then we have people there to call back and pre-register you and give you an appointment time to come in and get your vaccine, and worked really well yesterday. We're continuing it today, as Judy said, and we're working up to 300 a day is our goal right now. And then when you come to the clinic, don't come too early because there's no waiting area, and we're still trying to social distance and people wear their mask and do everything we need to do to keep you safe. And then it takes about 25 minutes or so between the time you register and get your vaccine, and then we have to observe you for about 15 minutes to make sure you're not going to have any kind of reaction. So all in all, it went really well yesterday. I want to thank the staff at the hospital, the doctors, everybody have been, tremendous helping with this. So as Judy said, we are all excited to get this going and see that glimmer of hope that there is an end to this at some point going forward.
Good, thank you.
Thank you.
So Madison, WFF, do you have any questions for us?
Yes, actually, I do have a question. It's a little bit of a loaded question, so bear with me. I know that this has been a concern among a few people. So correct me if I'm wrong, the
Moderna here Judy and I both are Moderna vaccines. So the Pfizer would be in another county that's giving Pfizer. And I'm going to defer to Judy, the nurse, to tell
Well,
you.
let me say up front that Pfizer was the first vaccine that came out, and therefore there's been more experience with it. The other thing is it was given at hospitals, and places that could do cold storage. Everybody who really has had a reaction to the Pfizer vaccine has been somebody who had a history of anaphylactic reaction or a history of severe reaction to it. And they would be no better off getting the Moderna vaccine. I mean, there's always, and there have been some reactions to the Moderna vaccine. There has been people have had to weigh the risk in terms of what is my real risk of this disease. And as you all know, we actually had a situation in this county, and the person themselves made that decision based on my job, based on my medical function. If I get this disease, I'm really going to be in trouble, so I'm going to take this risk. So one of the things that I think we've all backed up and done is been a lot more cautious about giving vaccine or the setting that we give vaccines in, for people who have a history of a significant reaction. And when you had rash from grass when you were 3 years old, we do not call that and we actually had somebody this morning. So at any rate, and I will say this, the hospital has been extremely cooperative with us because quite honestly, the health department, even though we've got the medical folks there, fire and rescue, we want you to be in a setting that if you had additional problems, that they could take care of those problems in an emergency room type setting. And so what we have done is we've had those people to register at the hospital, be sure that they alert them, be sure that they've gotten permission or at least approval from their physician so he could help with their care before they get that vaccine. But the other good news to this is if we can move on, get people vaccinated, those folks will have to worry less.
Right.
They really will have to worry less. So that's really the key to this.
Okay, thank you, Madison. Amy?
We had 3 questions that were COVID related from Lauren Harkson at 19. The first one was for the hospital. Lauren asked how many vaccines the hospital gave yesterday in total.
The hospital? We ended up giving 130 yesterday was our total. We had anticipated giving more, but there were some people that got there and couldn't take it. And again, yesterday was our run through to make sure everything was working. We weren't overdoing the main thing is to trying to keep people safe is the main thing, social distance and all that. But we're ramping up to 300 a day. That's our goal right now.
And then the next question was also for the hospital. Lauren said that she heard you mentioning the need for nurses. She asked if that was slowing down vaccine distribution at all.
Yes, somewhat. We've had to sort of piece together some nurses to help give vaccines. We've actually have some nursing students helping and some medical students helping us as well do that. But yes, if there's any part-time nurses out there that would like a part-time job, and Judy may need some too, to help give vaccines, we would love that.
And the last question was for both hospital and health department, just thoughts on vaccine distribution going forward. I think we pretty much touched on that too, didn't we?
Yeah.
Okay, that's it.
Thank you. All right, well, the vaccine is rolling out, but we still need to be cautious and careful. Please remember to social distance, to sanitize, and to wear your mask. I really did the distancing and the mask. I believe that my positive, who knows, but I could have done better with sanitizing, contact and such. I just didn't do the job I should have done there. But our next conference will be Monday, January the 25th at 10 o'clock. Thank y'all, and we'll see you then.